Welcome to the Basic Occupational Safety and Health BOSH training course for employees. At the end of this training course, there will be a quiz to test your understanding. You must at least get 80% to pass. If you scored lower than 80%, you can retake the quiz until you pass. You may also review the course anytime. In addition, there will be a survey and an evaluation that you must accomplish. So, let's get right to it. Let's first take a look at Department Order Number 198, Series of 2018. Implementing Rules and Regulations of Republic Act Number 11058, entitled, An Act Strengthening Compliance with Occupational Safety and Health Standards and Providing Penalties for Violations thereof. It was signed into law on December 6, 2018, and was in effect on January 24, 2019. The state affirms labor as a primary social and economic force, and that a safe and healthy workforce is an integral aspect of nation building. The state shall ensure a safe and healthful workplace for all working people by affording them full protection against all hazards in their work environment. It shall ensure that the provisions of the Labor Code of the Philippines, all domestic laws, and internationally recognized standards on OSH are being fully enforced and complied with by the employers, and it shall provide penalties for any violations thereof. The state shall protect every worker against injury, sickness, or death through safe and healthful working conditions. Coverage. It shall apply to all establishments, projects and sites and all other places where work is being undertaken in all branches of economic activity. Definition of terms. Certified First Aider. Any person trained and duly certified to administer first aid by the Philippine Red Cross or PRC or any organization authorized by the DOLE Secretary. Competency standards. Industry-determined specifications of proficiency required for effective work performance. Covered workplaces. Establishments, projects, sites and all other places where work is being undertaken wherein the number of employees, nature of operations and risk or hazard involved in the business as determined by the Secretary of Labor and Employment, require compliance with the provisions of Department Order 198-18. Department of Labor and Employment, accredited training organizations. Refer to those which have been granted accreditation by DOLE, pursuant to Department Order Number 16, Series of 2001. Employer. Any person, natural or juridical, including the contractor, subcontractor, and principal employer who directly or indirectly benefit from the services of the employee. Equipment. Any machine with an engine or electric motor is the prime mover. General safety and health inspection. An examination of the work environment, including the location and operation of machinery other than those covered by technical safety audits, ventilation, and other possible sources of safety and health hazards. High-risk establishment. Refers to a workplace wherein the presence of a hazard or potential hazard within the company may affect the safety and or health of workers. The following are workplaces commonly associated with potentially high-risk activities. Chemical works and chemical production plants. Construction. Deep-sea fishing. Explosives and pyrotechnics factories. Firefighting. Healthcare facilities. Installation of communication accessories, towers and cables. LPG filling, refilling, storage and distribution. Mining. Petrochemical works and refineries. Power generation, transmission and distribution in the energy sector. Storage and distribution center for toxic or hazardous chemicals. Storage of fertilizers in high volume. Transportation. Water supply, sewerage, waste management, remediation activities. Works in which chlorine is used in bulk. And activities closely similar to those enumerated above and other activities as determined by DOLE in accordance with existing issuances on the classification of establishments. Imminent danger. A situation caused by a condition or practice in any place of employment that could reasonably be expected to lead to death or serious physical harm. Low-risk establishment. a workplace where there is a low level of danger or exposure to safety and health hazards and not likely or with low probability to result in an accident, harm, or illness. Medium risk establishment, a workplace where there is moderate exposure to safety and health hazards and with the probability of an accident, injury, or illness. Micro and small enterprises, MSAs. Establishments employing less than 10 employees and the establishments employing less than 100 employees respectively, regardless of capitalization. Occupational health personnel. A qualified first aider, nurse, dentist or physician engaged by the employer to provide occupational health services in the establishment, project, site, or workplace. Occupational safety and health OSH consultant. A qualified safety officer for or its equivalent, duly certified by DOLE to perform and or render consultative services on OSH in at least 2 fields of specialization as determined by DOLE. Occupational safety and health, OSH, practitioner. A qualified safety officer 3 or its equivalent, duly certified by DOLE to render occupational safety and health services in a defined and specific scope or core competency. Occupational safety and health, OSH, standards. A set of rules issued by DOLE which mandates the adoption and use of appropriate practices, means, methods, operations or processes, and working conditions to ensure safe and healthful employment. Personal protective equipment, PPE, a specialized clothing or equipment designed to protect workers against safety and health hazards that may cause serious workplace injuries and illnesses. Safety and health audit. A regular and critical examination of project sites, safety programs, records, and management performance on program standards on safety and health conducted by the safety officer. Safety and Health Committee. A body created within the workplace tasked with the authority to plan, develop and implement OSH policies and programs, monitor and evaluate the OSH program, and inspect and investigate all aspects of the work pertaining to safety and health of workers. Safety and Health Program. A set of detailed rules to govern company policies, processes, and practices in all economic activities to conform with OSH standards. Safety Officer. Any employee or officer of the company trained by DOLE or DOLE accredited training organization and tasked by the employer to implement an OSH program. Safety Officer 1, or SO1. An employee who has completed the mandatory 8-hour OSH orientation course as prescribed in the OSH standards and 2-hour trainer's training. Safety Officer 2, or SO2. An employee who has completed the mandatory 40-hour OSH training course applicable to the industry as prescribed in the OSH standards. Safety Officer 3, or SO3. Has completed a 40-hour OSH training course applicable to the industry. An additional 48 hours of advanced, or specialized, OSH training course. And with at least 2 years of experience in OS. Safety Officer 4, or SO4. Has completed the 40-hour OSH training course. And additional 80 hours of advanced or specialized occupational safety training course. And an aggregate of 320 hours of OSH-related training or experience. Safety signage. Any emergency, warning, or danger signpost using the standard colors and sizes, including the standard symbols for safety instructions and warnings in the workplace. Workplace, any site or location where workers need to be present or to go to by reason of their work, and which are under the direct or indirect control of the employer. Worker. Any member of the labor force, regardless of employment status. Workers' OSH seminar. The mandatory 8-hour module conducted by the safety officer of the workplace as prescribed by the OSH standard. Duties of employers. Equip a place of employment for workers free from hazardous conditions that are causing or are likely to cause death, illness, or physical harm. Provide complete job safety instructions to all the workers, including, but not limited to, those relating to familiarization with their work environment. Ensure that the chemical, physical and biological substances and agents, and ergonomic and psychosocial stresses under control are without risk to health. Use only approved specific industry set of standards of devices and equipment for the workplace. Comply with OSHS including training, medical examination, and, where necessary, provisions on protective and safety devices such as PPE and machine guards. Make arrangement for workers and their representatives to have the time and resource to participate in the processes of organizing, planning and implementation, monitoring, evaluation and action for improvement of the OSH management system. Provide, where necessary, for measures identifying trainings and drills, evacuation plans, etc., to deal with emergencies, fires and accidents including first aid arrangements. Comply with all repertorial requirements of the OSH standards. Register establishment to DOLE is provided under the OSH standards. Duties of workers. Participate in capacity-building activities on safety and health and other OSH-related topics and programs. Proper use of all safeguards and safety devices furnished for workers' protection and that of others. Comply with instructions to prevent accidents or imminent danger situations in the workplace. Observe prescribed steps to be taken in cases of emergency. Report to their immediate supervisor any work hazard that may be discovered in the workplace. Duties of other persons. Any other person, including the builder or contractor who visits, builds, renovates or installs devices or conducts business in any establishments or workplace, shall comply with the provisions of this rules and all other regulations issued by the Secretary of Labor and Employment. Whenever two or more undertakings are engaged in activities simultaneously in one workplace, it shall be the duty of all concerned to collaborate and cooperate to ensure compliance with OSH standards and regulations. Workers' right to know. The right to safety and health at work shall be guaranteed. All workers shall be appropriately informed by the employer about all types of hazards in the workplace, and provided access to training and education on chemical safety and to an orientation on data sheet of chemical safety, electrical safety, mechanical safety, ergonomics, and other hazards and risks. All workers, including new hires, shall be provided training and information for all types of hazards in the workplace in a language and dialect that workers can understand. A reorientation on safety and health for workers in high-risk establishments must be conducted regularly, not less than once a quarter, and to be conducted immediately following any changes in the operations and production process. Workers' right to refuse unsafe work. The worker has the right of refusal to work without threat or reprisal from the employer if, as determined by DOLE, an imminent danger situation exists. As a preventive measure, the safety officer may, following his or her own determination and without fear of reprisal, implement a work stoppage or suspend operations in cases of imminent danger. The employer or safety officer cannot require the workers to return to work where there is a continuing imminent danger. A worker may also refuse to work until the lifting of the work stoppage order, or WSO, after implementing the appropriate corrective measures. Workers affected by the existence of an imminent danger situation may be temporarily assigned to other areas within the workplace provided there is no impending issue with safety and health. Section 24 of this rules shall apply during the period of such WSO, or suspension of operations due to an imminent danger situation. Workers' right to report accidents. Workers and their representatives shall have the right to report accidents, dangerous occurrences, and hazards to the employer, to DOLE and to other concerned competent government agencies. Reporting of accidents to DOLE may be made through any means of communication, including the DOLE hotline, whichever is most convenient to the worker. The same may be reported to the nearest DOLE, regional, field, provincial, or satellite office having jurisdiction over the place of the incident. Workers' right to personal protective equipment, or PPE. Every employer, contractor, or subcontractor, if any, shall provide his or her workers, free of charge, PPE for any part of the body that may be exposed to hazards, and lifeline, safety belt or harness, gas or dust respirators or masks, and protective shields whenever necessary by reason of the hazardous work process, or environment, chemical, radiological, mechanical, and other irritants or hazards capable of causing injury or impairment in the function of any part of the body through absorption, inhalation or physical contact. All PPE shall be of the appropriate type as tested and approved by DOLE based on its standards and/or other means of verification. The usage of PPE in all establishments, projects, sites, and all other places where work is being undertaken, shall be based on the evaluation and recommendation of the safety officer. All PPE must be of appropriate size, weight, and type to specific workers exposed to hazards from which PPE is meant, to ensure effective protection. Failure to provide appropriate PPE in high-risk activities shall give rise to the right of the worker to refuse unsafe work. Safety signage and devices. All establishments, projects, sites and all other places where work is being undertaken shall have safety signage and devices to warn the workers and the public of the hazards in the workplace. Safety signage and devices shall be posted in prominent positions at strategic locations in a language understandable to all, and in accordance with the OSH standards on the color of signs for safety instructions and warnings, Globally Harmonized System, GHS, pictograms, construction safety, classification and labeling of chemicals, radiation, safety instructions, and warning signs, set by DOLE. Safety and the use of equipment. Contractor or subcontractor, if any, must comply with the OSH standards set by DOLE on safety and use of such equipment in the different phases of the company or project operation, including the transport to and from the establishment, project, site, or place where work is being undertaken. Appropriate training and certification by the Technical Education and Skills Development Authority or TESDA, Professional Regulation Commission, PRC, or other concerned government agency, shall be a requirement for operators before use of equipment, if applicable. Occupational safety and health information. The employer, contractor, or subcontractor, if any, shall provide the workers in all establishments, projects, and all other places where work is being undertaken adequate and suitable information on the following: workplace hazards and the risk posed on the safety and health of the workers, such as chemical safety data sheets. Control mechanisms in place that reduces or minimizes the risk of exposure to hazards and other preventive strategies. Appropriate measures, including the probable location of workers, for the prevention, control, and protection against those hazards. And emergency and disaster management protocols, including proper evacuation and shutdown procedures. Occupational Safety and Health Program. For medium to high-risk establishments with 10 to 50 workers and low to high-risk establishments with 51 workers and above, the OSH program, which shall be duly signed by the employer, must include at least the following. 1. Company commitment to comply with OSH requirements. 2. General safety and health programs, including safety and health hazard identification, risk assessment and control, HIROC. Medical surveillance for early detection and management of occupational and work-related diseases. And first aid and emergency medical services. 3. Promotion of the following health domains. Drug-free workplace, Republic Act 9165. Mental health services in the workplace, Republic Act 11036. And healthy lifestyle. 4. Prevention and control of the following health domains. Human immunodeficiency virus and acquired immune deficiency syndrome, Republic Act 8504. Tuberculosis, Executive Order 187-03. And Hepatitis B, DOLE Department Advisory, 05-2010. 5. Complete company or project details. 6. Composition and duties of the OSH Committee. 7. OSH personnel and facilities. 8. Safety and health promotion, training, and education. 9. Conduct of toolbox or safety meetings and job safety analysis. 10. Accident, incident, illness investigation, recording, and reporting. 11. Provision and use of PPE. 12. provision of safety signage. 13. Dust control and management, and regulations on activities such as building of temporary structures, and lifting and operation of electrical, mechanical, communication system, and other equipment. 14. Provision of workers' welfare facilities. 15. Emergency and disaster preparedness and response plan to include the organization and creation of disaster control groups. 16. Solid waste management system. 17. Control and management of hazards. 18. Prohibited acts and penalties for violations. And 19. Cost of implementing company OSH program. DOLE shall prescribe a format that should be accomplished fully by the employer, contractor, or subcontractor, if any, in consultation with the workers and their representatives. Occupational Safety and Health Committee. For medium to high-risk establishments with 10 to 50 workers and low to high-risk establishments with 51 workers and above, the OSH Committee of the covered workplace shall be composed of the following: ex officio chairperson, employer or his/her representative, secretary, safety officer of the workplace, ex officio members, certified first aider, OH nurse, OH dentist, and OH physician, as applicable. Members, safety officers representing the contractor or subcontractor, as the case may be, and representatives of workers who shall come from the union, if the workers are organized, or elected workers through a simple vote of majority, if they are unorganized. The OSH Committee shall effectively plan, develop, oversee and monitor the implementation of the OSH program. Safety Officer. In the implementation of OSH program, safety officers shall be employed or designated with the following duties and responsibilities. Oversee the overall management of the OSH program in coordination with the OSH Committee. Frequently monitor and inspect any health or safety aspect of the operation. Assist government inspectors in the conduct of safety and health inspection at any time whenever work is being performed. Issue work stoppage order, WSO, when necessary, based on the requirements and procedures provided by the OSH standards. Workers' welfare facilities. All establishments, projects, sites, and all other places where work is being undertaken shall have the following free welfare facilities in order to ensure humane working conditions: an adequate supply of safe drinking water, adequate sanitary and washing facilities, suitable living accommodation for workers, as may be applicable such as in construction, shipping, fishing, and night workers, separate sanitary, washing, and sleeping facilities for all gender, as may be applicable, lactation station except for those establishments as provided for under DOLE Department Order No. 143-15, ramps, railings and the like, and other workers' welfare facilities as may be prescribed by the OSH standards and other issuances. Employer's responsibility and liability. The employer, project owner, contractor, or subcontractor, if any, and any person who manages, controls or supervises the work being undertaken shall be jointly and solidarily liable for compliance with occupational safety and health standards, including the penalties imposed for violation thereof as provided for in this rules. Payment of workers during work stoppage due to imminent danger. If stoppage of work due to imminent danger occurs as a result of the employer's violation or fault, the employer shall pay the affected workers their corresponding wages during the period of such stoppage of work or suspension of operations. For purposes of payment of wages and any other liabilities arising from the WSO, the employer is presumed the party at fault if the WSO was issued secondary to an imminent danger situation which would imperil the lives of the workers. A mandatory conference not later than 72 hours shall be held to determine whether the WSO will be lifted or not. Employees' compensation claim. A worker may file claims for compensation benefit arising out of work-related disability or death. Such claims shall be processed independently of the finding of fault, gross negligence, or bad faith of the employer in a proceeding instituted for the purpose. The employer shall provide the necessary assistance to employees applying for claims. Prohibited acts and its corresponding penalties. Failure or refusal to comply with OSH standards or compliance orders shall be deemed willful when done voluntarily, deliberately, and intentionally. An employer, contractor, or subcontractor who is found to have repeatedly violated the same prohibited act shall be penalized of the corresponding fine plus an additional fine equivalent to 50% thereof for every instance of repeat violation. The Department of Labor and Employment's responsibility. DOLE shall be primarily responsible for the administration and enforcement of OSH laws, regulations and standards in all establishments and workplaces to effectively implement the provisions of Republic Act No. 11058. This is the end of Module 1. Thank you for paying attention.